Welcome back to West Texas View.
We were talking with Amy just before the break about her job as development director, and one of the things she does is raise funds because you are, tell us how you get your funding for that. It's not just from payment for counseling services.
It is not just from payment for counseling service because one, counseling is one of the things we're trying to make awareness of is not always covered. Under health insurances, it isn't, mental health is not always available to everybody, and it's certainly not always available at the level some people may need it. So that's one of the areas that causes, it makes it difficult for people to get in and get services. So one of the things that we do at Samaritan, and several other entities do, but that we do particularly, is we have a community assistance fund as well as a military assistance fund. And so an individual who needs services, who comes in and doesn't have the financial ability, they don't have an insurance, their insurance doesn't pay,
or their company
doesn't pay, whatever their situation may be, we're going to provide those services to them. And we have a sliding scale that allows us to provide those services based on how much income that family makes, how many people are in the home, any number of things that can impact that for those individuals, and we have some leeway whenever they're in a crisis situation to make sure that that crisis is taken care of first. But the funds that fund that, because we couldn't make it, we couldn't keep those therapists hired, keep them in this area if we had to live just on what an insurance was able to pay us to do that. And so we do rely heavily on our community. We rely on the foundations in the area. Like we said, we serve over 30 counties between western Texas and eastern New Mexico. And so we go out into those counties and we ask the individuals in that. Samaritan was started 40 years ago by churches, and we have a lot of church support. They saw the need to have that faith-based counseling, and so we have that support from individual churches. Some churches actually set up a fund so that they can pay
give you a
for.
monthly stipend.
Some people give us a monthly stipend. Some people have the ability to pay for individuals that they support, be it members or non-members, to get those services when they've been working with them and identified they need those services. We do have some contracts with the organizations, with different organizations in the area of businesses that they pay us a flat rate, and any of their employees that need our services come in. And so they know that that is their program. They have an employee assistance program, and so they don't have to question, oh gosh, what do we do with this employee? Where do we send them? Those employees know where to come. But as with lots of other organizations and nonprofits, you have to get out there. So we write a lot of grants. That is the one thing I have done. I was in the midst of doing that last time I was here, and we have received some of those.
But
we're
you
very
receive
pleased.
grants for veterans and their families.
We do.
And
We do. We started off with being part of a large government grant program that's no longer in existence, but we have even built on that, and we have the Military Assistance Fund. So any veteran or their family member, spouse, child, family member of a veteran who needs those services can come out and see us, and for a flat rate for every visit. So all of those programs, the CAF, the MAF, any of those programs are funded because of and through grants, through donations of individuals, through our Securing Samaritan's Vision, which is an organization that is setting up an endowment for us, and through wonderful events. And our big event is our Family of the Year, which we are working on. We recognize every year 4 families from our major areas, Big Spring, Midland, Odessa, and Andrews. And we select those families through a committee. People nominate them within their communities. And over the years, this event has changed. This is the 22nd year of this, I believe. But over the years, it's changed, as all events do. And we now do an evening event with some entertainment and some fun things. But the focus of that is to bring those families in and tell their stories.
Spotlight. Because your goal is that every family should be healthy.
A healthy family starts with all those things we've talked about. It's the mental, it's the spiritual, and it's the physical, and all of those things being in place. And there's a lot of stressors. There's a lot of stressors in life. There's a lot of stressors in our community. And there are a lot of things that just sometimes pull on us, and we all need that help. And there's nothing wrong with asking for that help. And I think that's one of the things we want to get out about Mental Health Awareness Month is, you know, we all have it. We have some wonderful physicians that are on our consultative staff at the center. And one of those physicians has been sharing with us some really good educational information about how much stress and depression play a role in our health, and how much after a certain period of time, if you've lived with that, that can be even more negative towards your entire life history than some diseases.
And your mental health can wear down your physical health, and vice versa.
Absolutely.
And you need a strong spiritual base in order to, and one of the things that I want us to talk about early on is if there's someone who says, I don't go to church, I don't understand about this spiritual base, so that's not a place for me to go counseling. That's not true. You're not trying to cram down church attendance or anything like that. What you're doing is bringing that spiritual dimension into their counseling, their peace of mind, and their hope, and all of those kinds of things that are involved in.
Absolutely. There is nothing, and I know Risse can speak to this, we are not tied to any religion. We have people of every world religion, regardless of what they believe in. And our counselors, if a person says they want spirituality included in their counseling, then our counselors are going to work with them to talk about what that is, what spirituality means to you, and where your spiritual base comes from, and whether you have a Muslim belief, a Christian belief, whether you're
Jewish
Protestant, Jewish, anything that comes into play, we're going to meet you there and have that base. And that's what that's about. It's not about us pushing any one belief on anyone.
And that brings us to the end of this segment. We'll be back in just a minute and continue or conclude this conversation. But I want us to talk a little bit more about both the services and the Mental Health Awareness Month. We'll see you in just a second.
Stay tuned. West Texas View will be right back.